Hi, I'm Alyssa and I am a speech language therapist from Elmhurst Grad School. And I just wanted you to confirm your name and date of birth for me before we begin.
My name is Mary Long. I was born on April 20th, 1997.
Okay. And Mary, is that okay that I call you that?
Yes.
Okay. Are you experiencing any pain?
No pain.
Okay. And why are you here today? What's the reason for your referral?
Well, I had never had an incident of choking before, but I choked last night, so they wanted to make sure everything was okay so I could eat.
Okay. And that happened last night?
Yes.
Okay. Are you on any medications?
No.
Do you have any allergies?
No allergies.
And what is the primary language spoken in your home?
English.
And what's your educational history?
I'm in graduate school now.
Okay.
So I have my bachelor's.
Okay. And your hearing status?
I would say it's within normal limits. Normal.
Okay. And your vision?
Normal. I don't have glasses or contacts.
Okay. And have you experienced any drooling?
No drooling.
Coughing?
Only immediately following the choking last night, but not normally, no.
Okay. And you said that's been your only instance of choking?
Yes.
Okay. Do you have any difficulty swallowing solids?
Nope.
Liquids, so juices or anything?
Nope.
Okay. Do you have difficulty swallowing pills?
No, not at all.
And do you have any pain with swallowing?
No pain.
Does food ever get stuck in your throat or in your jaw or anything like that?
No, nothing significant.
Have you experienced any recent weight loss?
No.
And do you have a history of aspiration or pneumonia?
Neither.
So now I just have a few questions about your current diet.
Okay.
So solids are kind of anything you chew and eat, foods. Are you on a regular diet or do you have any specific?
No, I've always eaten anything.
Okay.
No restrictions.
And what about liquids?
Same thing, no restrictions.
And you eat orally?
Yes.
Okay. Do you independently feed yourself or do you need some assistance?
I'm independently feed myself.
Okay. And would you say your endurance during meals is good, fair? Do you need to take breaks between chewing or?
No, I can eat consistently.
Okay. So now I'm just going to look inside your mouth and observe some of your oral structures. So first I'm going to just look at your dentition, so your teeth.
Okay.
Could you open for me? Okay. Now I'm going to just observe your lips. Okay, and could you pucker and retract them? So, okay, great. And now, could you stick out your tongue for me? Okay, great. And could you stick it out and then pull it back in? Perfect. Could you keep your mouth open when you pull it back in? So kind of like, perfect. Thank you. And then could you lateralize it? So that means to kind of move it side to side. Perfect. So now I'm going to just look at your jaw.
Okay.
And basically I just want you to open and close your mouth. Okay. Could you move your jaw side to side? Thank you. And could you stick it out and then retract it back? Great. Okay, now I'm just going to look at the roof of your mouth and just observe it. Okay, great. So now, could you just cough for me into your arm? Great, thank you. So now I'm kind of just looking at vocal quality, so just how your voice sounds. Could you say ah for as long as you can, please? Okay, great. And could you say ah and get progressively louder? Great, thank you. Okay, so now we are going to do the swallowing portion.
Okay.
So could you just do a dry swallow for me? I'm going to place my hand on your neck and just feel the structures, if that's okay.
Okay, sure.
Okay, great. Thank you. Okay, so first we're going to just start with a thin liquid. It's right here, and I'm going to give you a small amount on the spoon, and again, feel the structures in your throat, and then we're going to progressively move from the spoon to the cup to the straw.
Okay, great.
Trial number 2. We're going to do 2 of each.
Okay.
Okay, great. Could you... Okay, great. Thank you. And then can we do it with the straw, please?
Sure.
Great, thank you.
Mm-hmm.
And could you say ah after the
Yes.
next trial,
Yes.
please? Thank you. Okay, so now we are going to make it a little bit thicker, and so I'm just going to mix it in here a little bit to make it a little bit thicker, and then we're going to do the same thing. Great, thank you. Thank you. Okay, now again we're going to do it with the cup.
Okay.
Great, thank you. And lastly, we're going to do 2 with the straw. Great, thank you. And then next we are going to just make it a little bit thicker than that. Okay. Great. Okay. Move the cup. Great, thank you. Okay, and lastly, it's going to be a little thick. Okay. Great. Just with the cup, please. Thank you. And it might be a little difficult, but can we try with the straw, please? Great, thank you. Okay, next we're going to do the solid food trials. So first we're going to start with applesauce. Is that okay with you?
Sure.
Okay, and you can do it yourself. And I'm just going to feel again if that's okay. We're going to have 2 bites. Great, thank you. Okay, and next we're going to take this and we're going to just dip it into the applesauce.
Okay.
Okay, great. One more time.
Thank you.
Great, thank you. Okay, and lastly, we're going to try 2 with just the regular. Great, thank you. Okay, Mary, so after we've done the swallowing and oral examination, I have no recommendations, and I think it's safe for you to continue eating all the regular typical foods and liquids you have been with no changes. And if you could just continue to obviously use precaution when swallowing and chewing, just so that everything is safely chewed and that the choking instance does not occur again. I don't have any other referrals to any specialists. I think it's pretty safe for you based on what we found today. So, do you have any questions?
No questions, thank you.
Okay, great. Thank you.